So what are you working on currently, or what have you been focused on as far as understanding the disease or developing treatment goes?
Yeah. So it's an exciting area of work because I think within rare neurologic diseases in general, there's a lot of work going into disease modifying therapy. So for so long, we would say, okay, here's some medicine to treat the seizures. Here's some medicine to treat your movement disorders. And, good luck. We hope you feel better, right? But we know there's nothing we can do to slow the progression or stop the progression of the disease. There's one form of the NCLs called CLN2 disease that does have a treatment for it that's approved. And that was a very exciting advancement for us, and it can be very effective. And that's really opened up the doors to other kinds of treatments and other kinds of treatments to study. So the pipeline is very robust right now because it's very exciting, although we don't have anything else approved. And I have a couple of areas of interest within that. So one that I feel very passionate about is what we call natural history studies. So you won't really know if a drug works if you don't know what would happen if there was no drug there. So you can't really tell if it's helpful. And so what we really need to understand, especially in really rare diseases, is, well, how does it really unfold? How quickly do things progress generally? What symptoms come up when? And that way you can really get a better sense of if this treatment is slowing that down or even halting the progression. And so the University of Rochester, where I am, before I even started, about 20 plus years ago, started a natural history study in the NCLs. And we've been gathering data for the past 20 years on the different forms of the NCLs. And that's been really helpful for us to understand some of the natural history, particularly in CLN3, which is one of the more common forms of disease within the United States, one of the more common forms in the NCLs, that is. And so that's been really helpful for us to think about, well, how do you design a trial? How long does it need to be? What are your outcome measures going to look like? And so the natural history aspect is something I'm very interested in, and I think it's really important across all rare neurologic diseases. But then also, I'm very interested in thinking about how you apply it to the pipeline. How do you design these trials? Because we have a lot of different companies that come out with these potential agents, which is exciting, but how do we test it? So that they kind of align that way.
So do you find that you're combing through data from past clinical trials, or where is the main source of the data coming from?
So we have a lot of data from our group. So what we've done is we will either have people that come to our clinic site and participate in the study where we will do a bunch of different kinds of tests on them. We'll do a rating scale that our group developed where we're really looking at kind of the global burden of the disease. We look at their physical impairment. We look at the seizure burden, the behavior and mood burden, and then the kind of functional impact. We have a neuropsychologist who's been involved in this for over 20 years too, from the very beginning, who's done a lot of the cognitive data and testing on these children as well, which is a really niche skill set because you're doing cognitive testing on children who are mostly blind. And so that takes different kinds of tests that you can and cannot use. And so we use a lot of our data to help think through the different kinds of ways to design trials. But then we also are really collaborative with other people who specialize in this. So one of the bigger parent family advocacy organizations, the Batten Disease Support Research and Advocacy Foundation, BDSRA Foundation, has been a really great support of moving the science forward and has designated us and a select few groups of centers as centers of excellence. And so we meet once a month virtually, and we talk about how do we move things forward? How do we bring our data together and create a really robust natural history platform to be able to feed more into the pipeline and better testing drugs?